Welcome to our broadcast, The Path to Be Well, a knowledge and learning session. To all our listeners, we're so happy that you've joined us. And please note that you can also subscribe on our YouTube channel or find us on weedwell.live. These sessions are focused on adding clarity regarding cannabis as a treatment option and whether or not it's right for you, and will bring clarity and help you make informed decisions with respect to improving your quality of life. Now, you may know someone that could benefit from this type of information. So please do us and them a favor by sharing this event. My name is Mark Trombley, a founding member of Simcoe Holistic Health, now Weedwell. I want to share with you how I became involved with cannabis as a medicine. As a teenager, I did sample marijuana and quickly concluded that it just wasn't for me. I will admit, I did find myself judging those who did consume marijuana, thinking their sole motive was to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. A loved one was diagnosed with MS. After many months of symptom manifestation resulting in sleepless nights, I witnessed firsthand how cannabis can help alleviate symptoms and improve sleep. My eyes were open and my interest further increased. As a result, Simcoe Holistic Health opened its doors in 2013. Since then, we have served nearly 6,000 patients ranging from ages 3 to 93. I have personally witnessed countless individuals and families experience improved quality of life. Having said that, I've also observed that cannabis treatment is simply not for everyone. And for that reason, I want to caution our listeners that cannabis treatment is not a one-size-fits-all. Determining if cannabis is an appropriate treatment requires the attention, care, and focus of your healthcare team. At Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. For those of you who have been following us for the past few months, we've had the pleasure and honor of having special guests that are patients and clients of Simcoe Holistic Health and sharing their journey. So today I'm very happy to have with us Judy, who's been a client at Simcoe Holistic Health pretty much since inception. I'm going to say 2014 or so. So Judy, welcome. Nice to see you.
Thank you very much. It's a pleasure.
So Judy, would you just share with our audience a little bit about yourself and what was a day in the life of Judy prior to medical cannabis?
I was diagnosed with rheumatoid arthritis back in 2005. And at that point, they experimented with many drugs in order to kind of suppress the pain, to kind of make you bear with it. And through the years of 2005, probably to 2009, I started to see different benefits and other ways to go rather than with the Western medicine tradition, and found that in the legalization of the marijuana with the medical license that changed my life completely. I went from an enormous amount of pills on a daily basis, injections every so many months, injections every week for certain elements. And now, using the medical marijuana, I have reduced my amount of intake of medication and has solely put my trust into the medical marijuana field with less repercussions, with less side effects, and just a better all understanding on how much it really does help to take me away from the normal pills to taking the marijuana. So I found the benefits have been tremendously uplifting. It's something that I can control when I want to control it. I can choose my level of pain level, medication, and just all in all, it's just overall been a complete turnaround.
Good.
So for that, I'm truly grateful, and to be having the options of what suits me best when it happens.
Having that flexibility. So, what I'm hearing, Judy, and correct me if I'm wrong, but you became an advocate for your health. You wanted to look at alternatives, which you have done. Was that a difficult thing? Did you find that there was support out there, perhaps a family member or a friend that kind of guided you through that process? Tell us a little bit about that.
Well, I first heard about it through a friend, that there was a way to go about it legally. And that changed my life. I was on the verge of having increased pain medication, increasing doses of injections. And ever since I've been on the program, the medication has totally almost been eliminated completely. And I can rely on something and be my own doctor and know what's best for me when it happens. And it's just been a world changing.
That's awesome. Now, Judy, other than pain relief, were there things that you had difficulty doing prior to treatment with cannabis? Can you touch on that?
I would say sleep deprivation was definitely a factor because I was in chronic pain day and night. And I found that with the use of the medical, whether it be dry or in the CBD oil category, it certainly allowed me to sleep better and to wake up not already in a chronic state, but more in a relaxed state where I could actually control myself and my emotions because it was highly emotional. To be able to live with a chronic pain and not be able to do anything about it. But I did find that it did help me sleep. It helped with some mental disorders that I had because it was so inflicting that I was basically fighting myself on trying to find a better way to cope with this. I found that medication and pills changed my taste. It changed my feelings mentally and physically. And it just, as a pain management, it's just something that I can control now through my own willingness, through my own desires on what works for me.
Now, Judy, with your struggles of pain, discomfort, um, was it impacting your ability to do, say, your chores at home, or if you were working, making it to work every day?
It can completely changed everything. The nausea, I was so nauseated that I found that this calmed my stomach, it calmed my nerves. I actually had less anxiety attacks. I wasn't as depressed as I was. And of course, the chronic pain seemed to be able to be in control at my will. So for that, I'm truly grateful that I found another alternative, which is a natural source of pain medication, as opposed again to the pharmaceutical industry that just loves to give you more than you're capable of handling without physically changing you.
hmm
So
As you're as you're sharing, Judy, the word breakthrough comes to mind. Would it be an exaggeration or a stretch to say that for you that was a breakthrough?
it was a godsend. It was a completely breakthrough. Whereas I said I could control it. It helped with my functioning. It helped with my eating. It helped with my sleeping. It helped control the chronic pain. And I just was able to function better as a human being, knowing that I could self medicate when and if needed on my own time and be my own best doctor, knowing that my symptoms could be controlled by something as simple as a natural herb.
hmm Um, it's been our experience listening to clients like yourself for a number of years and sharing their story that often they don't come to the realization of just how many things were not right until they start to feel better. It's like peeling back the onion, if I can use that analogy.
Mhm.
Uh, their lives is in somewhat of a chaotic state, just struggling to get by. When you don't sleep well at night, the next day doesn't look so bright, even to put your feet down on the floor. And that as they start to feel better with their new treatment plan, that they start saying, wow, as you said, I don't feel nauseated as much as I did. I don't feel as stressed. And now that opens a door for doing other things that are beneficial as well. And I'm just going to use an example, maybe going out for a walk now, a meeting with friends that might have been difficult. I don't want to put words in your mouth, but I've heard stories like that. And I suspect yours, might resemble that to some extent.
I did find that my mobility was actually increased, where I was able to go for walks, where most of the time I was housebound. I wouldn't use the word forcing myself to go out, but wanting to go out and not being able to do that was very, very frustrating. To function outside of the home was so important for fresh air, for exercise, to keep the disease under control by having mobility. And it just relieves everything from mental to physical. And it just changed my whole life. That finding that there is a better alternative way, rather than not being able to feel or touch or smell things because we're so induced with the pharmaceutical company. And I just eliminated that from my program and solely rely on something that I trust. And that being for medical purposes has totally changed my life.
Oh, that's awesome. I love to hear these stories. So, Judy, back in the earlier years, when you were introduced to cannabis for medical purposes, obviously back in the day, oils or extracts were not available, so you would have been, I guess, limited to dry. And has that evolved since then for you?
I have tried the oils, and I do have the drops and things, but I guess maybe I'm just a little old fashioned to the point that I can kind of control what I'm intaking in this way as opposed to taking the CBD. But they both work tremendously. I guess it comes down to a preference or what I'm used to, but I have been moving forward doing the CBD oils and just broadening my education on that. Every little bit helps when it's done in a natural way. And moving forward, it's completely, as I had mentioned, it has changed my life, or I am the person that I was before I got suffocated by medication, by pills. So I'm very delighted.
And I understand that for those who have been accustomed to, ingesting through inhalation, or rather through medicating through inhalation, that there could be a little bit of reluctance when we're finding a level of relief with something that we've been accustomed to and learned to rely on, to transition to an extract. But not only an extract, in this case, CBD wasn't readily available back in 2014. It wasn't until 15, 16 where it really started to gain momentum and popularity. So again, I'd like to hear what you would have to say about that.
About the
transitioning, right, from inhalation to an oil, but also from THC to CBD.
I think the number one thing is that you need to be educated on what it is and what exactly it is that we're needing as a self-individual. And I think the education is everything. So when you have a few drops underneath your tongue to help you sleep, it's easy to digest. It's almost as an instant kind of relief. I know that mentally I can sleep and I fall asleep. I dream well. I sleep well. I feel up refreshed. I have less symptoms of my disease because I'm more level-headed. But I did find that experimenting and with the knowledge that's out there, it's just so important to read it's not for everyone, whether it be CBD or whether it be with the inhalation. But I think that we all find our knack, and that some things definitely for me have opened my eyes as far as doing oils, because I was totally so foreign to that. But when I started, there was only one way, and it was the better way. But now there are better ways, and just more simple ways of controlling your own dosages, of controlling your own treatment, and it's phenomenal.
Well said. Well said. So, Judy, in your circle, in your family, initially, was there a stigma? Was there a reluctance, even perhaps on your part? Tell us about what that looked like back in the day.
Well, I think back in the day, it was like if you ever got in trouble attached to the medical, don't give us a call. They really looked at it as a taboo and didn't realize that this isn't a recreational drug. This is a beneficial medical drug. It can actually change my life as well as many others. And I think now, within my circle, within my family, they all agree that there are benefits to it, and they're not shone upon it now. I've educated them. They've educated me that yes, you can change your opinion about something as natural and as it's perfect. That's and I think we're all at a balance now where we understand that it's not a taboo, but rather this is the new future. It's the way to go.
So what I'm hearing, Judy, is that it was a transition. It was a process, a journey.
Absolutely.
I take it didn't happen overnight, but I suspect you woke up one day and said, you know what, there's got to be something better. I can't continue this way here. So you started to investigate and do your own research. Was there a support system through that to help you, at least initially, or even beyond that? Or was this kind of yourself in a silo and information was available to you?
I think I felt trapped, that I was suffocating with more increases of dosages. And I was actually on my way to pick up a prescription that had been increased for pain. And then I just stopped at my doctor's office. I have to see you. I said, I need to go to a pain clinic. And this is where I was first introduced to the medical side of it. And from that, I just began to grow with knowledge and grew with experience that the benefits of it were just amazing. But I was starting to lose my identity by being overwhelmed by popping pills, by taking medication every 4 hours and do this every day and have a routine where you can't survive without the Western medicine doctors. And that's just not the route for me. I felt like I was changing. I couldn't, like I said, with taste buds and feeling, and everything was so induced by the wrong medication that I just took it upon myself to say, I can't go further with this. I can't keep increasing something that'll never get better. And I found with the medical marijuana that it just changed everything. It just allowed me the freedom to be able to control my own pain, to be able to control my own dosage. And I didn't necessarily have to take it at a certain time of day. So it gave me the flexibility to calm down, to do some research, to really explore what's out there to make my life better without having to be induced by something that's not natural.
So you had to recognize where you're at, and you had to make a choice. You had a choice at that point, and and take the first step, which you've done. So basically, becoming an advocate for your own health. I think we've mentioned that already.
Absolutely.
But then, committing to staying on the program and fine tuning and adjusting and experimenting. Would you agree with that?
Absolutely. I've tried things that I'm not used to doing. Like I said, I'm an old fashioned inhaler, but to try different things that are out there with the drops, with the capsules, it just gave me back my identity. It's as simple as that I was able to actually go, wow, I feel as normal as I can be without going down that dark path of increasing dosages. And it's not solving the problem. It was just covering it. Where this, I actually feel that I have control of myself. So it's completely changed everything and how I think about how to make things better for me. I don't have to run to my doctor every time I have an ache and pain. I can control it on my own. And that makes a world of difference when we can be our own best advocate.
Exactly. Well, congratulations for all of those steps and your journey. Uh, would you? We often, when seeing a patient or a client for the first time, it's not unusual for them to say, "I've been thinking about this for a while." And we recognize the value of having someone like yourself, Judy, share your story, because I'm almost confident that there's a listener that will listen to this and say, wow, that sounds very much like me. And if it's worked for Judy, I'm willing to give it a try. We'll never say that it's a guarantee, because it is not. Uh, People respond differently to the treatment. But there is such value in hearing the story that people can relate to, and often that's a little nudge that they need to take that step.
Absolutely. I mean, it's good from anything from glaucoma to your PSTDs. I know working with veterans that they've used it to control their mind, to even smoking. It is the benefits of smoking the medical versus smoking cigarettes, which I've quit over a decade ago. But it really does help to expand your lung capacity because you are actually doing deeper inhales. There's so many minute benefits to it. But I mean, and it's good for cancer treatments. It's good for, like we said, anxiety, depression, anything that is out of our reach that we can't control. There are so many benefits to this. And I think if anybody wanted to know more, they could just simply look up the benefits to this uh, phenomenal direction that we're moving with this. It's unlimited possibilities and the freedom to be your own best doctor, I would say.
So, Judy, well said again. So, for a listener that is listening, has heard your story, what recommendations or advice or that you would have for them?
Well, I say don't be afraid to step outside of the box of thinking that we're so programmed to believe that I got to call my doctor. I got to see my doctor. I need this. I need that. I can't survive without it. The fact is that we've become so reliant on somebody else controlling us that we forgot how to control ourselves. So this is my method, my way of controlling my body, my mind, my diseases. And it's just changed the world knowing that I have control. And I would think that anybody who's hesitant on moving forward with something better to really look into the research, look into the websites, call your doctor, such as yourselves, and look for the information. There's so much out there that once you read it, it's so logical that how did we ever get trapped into a world of the past where we have so much of the future to grow?
So, Judy, as we wrap up here, what would be your parting words of wisdom?
I would say don't be afraid of the unknown, because once you try something new, you just may find that this is the answer that you're looking for. And don't stereotype it as a taboo, because in the scientific world of today, it is anything but.
That's awesome. Judy, thank you so much for joining us today. And for me, it was a pleasure seeing you again,
Absolutely.
and hearing your testimony was really gratifying, to say the least. So thank you again for that. And hopefully we'll get to see you in the not very distant future.
Absolutely. But this, on a final note, this medical marijuana is a way to get back your life. It's as simple as that, whether it be chronic or whether it be treatments that we're taking, that just, there's always a benefit. It's so eye-opening if we just do the research.
Very good. Awesome. Thank you so
Thank
much
you.
again, Judy. Yeah.
Thank
Take
you.
care. Enjoy the rest of your day.
I will as well. Thank you.
Okay. So, in closing, I'd like to remind our audience, our listeners, that these information sessions are intended for individuals who are in generally good health, are generally well adjusted, are functioning effectively. That these information sessions do not involve the diagnosis or treatment of any medical or mental disorders and does not prevent, cure, or treat any mental disorders or medical diseases. The opinions you've heard today are opinions of one client. Further to these sessions are not a substitute for therapy, counseling, psychoanalysis, medical treatment, substance abuse treatment, or the advice or services of a medical professional. It is your responsibility to seek independent guidance from medical professionals to the extent necessary. So please do speak to your healthcare provider about the appropriateness of cannabis as a treatment option. And for those of you who have already taken some steps in improving your quality of life, congratulations. Remember that your journey is your journey. And as long as you're taking some steps forward in improving the quality of your life, you should be proud of the progress that you're making. At Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. On behalf of our team, those behind the scenes, we look forward to seeing you the next time that you join us. And until then, be well. Thank you for joining me. I'd like to take this time to share with you how I first became interested and then involved with cannabis as a medicine. My name is Mark Tremblay, a founding member of Simcoe Holistic Health, Ontario's first medical clinic dedicated to the treatment and care of those patients considering cannabis as an option. As a teenager, I did sample marijuana and quickly concluded that it simply wasn't for me. I'll admit I did find myself judging those who did consume weed, thinking that their sole motive was strictly to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. A loved one was diagnosed with MS. After many months of symptom manifestation resulting in sleepless nights, I witnessed firsthand how cannabis can help alleviate symptoms and improve sleep. My eyes were open. My interest further increased. As a result, Simcoe Holistic Health opened its doors in 2013. Since then, our clinic has operated under 4 Health Canada regulations and served nearly 6,000 patients ranging from ages 3 to 93. I have personally witnessed countless individuals and families who experience improved quality of life. Having said that, I've also observed that cannabis treatment is simply not for everyone. As we continue to grow and expand our reach, Simcoe Holistic Health is rebranding to Weedwell. For more information, visit us at weedwell.com or follow us on our social channels. Till the next time, be well.